Well, hey everybody! Thank you for joining us once again on our Gussy's Gut podcast. I am so honored to be here today with Dr. Elaine Cebuliak. She has the website animalwellness.com.au because she's in Australia.
Yeah.
That's right. And so, what we want to do today is talk about Dr. Cebuliak's passions in her practice and in her life. She has a very big life. I'm not even going to try to introduce her with all of the things. We're going to see those over the next few minutes. But she works in both the human world, but her most of her career is obviously in animals. And I'm really just so excited to introduce you. So, Dr. Cebuliak, welcome.
Thank you. Thanks for having me. Yeah, nice to be part of the international integrative vet world as well. Has been part of my passion. So I grew up in Hawaii, actually. So I know some of these amazing vets, and we were just chatting about Iho Basco, who lives in Hawaii, and introduced me to mushroom therapy many, many years ago for immunotherapy and part of cancer treatments. And we were also just chatting before we started about how the integrative vets have this developed art part of their brain and recognize the body, mind, spirit, and how that's been part of my background as well. My dad was a chiropractor, so I actually knew that there were other methods for treating the body, and he was big, as most chiros are, into supplements. So I remember him making a drink every morning before he went off to work. Yeah, it was tiger's milk and supplements, and he always talked about having a banana and an egg regularly. So later on, I realized potassium and the protein levels, just food, right? And
Yeah.
Mum was a really good cook. She was Polish, and we always had a salad before dinner with a squeeze of lemon on that. And then later, when I studied naturopathy, it was about getting the gastric juices going with that little bit of bitter. And then when I studied TCM and Chinese food therapy, it sort of all comes together. So life is quite a journey where you recognize food therapy is essential. And growing up in Hawaii, Chinese food therapy was actually just in the background all the time. You go out and have a bowl of soup, and the Asians kind of know. They talk about heat and cold, and they talk about food therapy. It's just normal. You should have ginger before you eat, and everyone's eating a little bit of ginger. You should have ginger tea if you're not feeling well. So it's all just common stuff.
No
And
pun
then when you
intended, but you were no tea pun intended, but you were literally you were steeped in this knowledge from
yeah,
being a very young kid.
that's right. So it was normal. Yeah, I remember waking up one morning. I was a teenager, and my neck was sore. So Dad did that, and it was all better. I was like, oh, that's cool. So I understood there was things to do with the body. When I was studying my vet degree, I actually studied remedial massage just for fun and essential oils just for fun, and that was back in 1978. So now we've got doTERRA and Young Living and multi-level marketing essential oils, and I'm like, yeah, that's just normal. Yeah,
Wow.
and
Wow.
then I tell people, you can use good quality oils from other companies as well. So it's interesting. Yeah.
What
So yeah.
let's just tee off on that super quick. What let's pick three. I'm not going to ask you for your favorite, but just pick three brands that you like the oils from.
We use plant therapy quite a bit. Sydney essential oils. There's one called Amazing Scents that's become a friend of mine.
Great.
And Pranaram, I think is the name from France. They're very good. All of those are good quality oils.
Can you say that slower? The
The
one from France.
last one, I think it's Pranaram. I have to check.
Pranaram.
Yeah,
Okay.
something like that. But Sydney
Okay.
Essential Oil Company is quite good. So plant therapy, you can buy frankincense in 100 mils. So those are the sizes of the bottles that we have. And I mean, it's just unaffordable in those small little 5 mil multi-level marketing kind of groups. And we use it a lot for cancer therapies. For instance, I make a healing herbs. We do have a website for that, healingherbs.net.
Okay.
.au, I think it is. And that product I actually bought off of a naturopath friend of mine who was retiring from that. And it has aloe and well, quite a few herbs, calendula, a few other things. Quite safe, so dogs can actually eat it and ingest it, and it will help with all kinds of gut issues as well if they happen to swallow it. But I use that little tub of I think it's 60 grams in the tub, and I'll put frankincense. Oh, you found it. Good. Frankincense and myrrh and lavender, sometimes suga, things like that that have anti-cancer properties. Frankincense has some very good information now if you go to PubMed and look it up. So Boswellia serrata, there's all different frankincenses, but the sacred one, which is serrata, is the one that I tend to use mostly.
Yeah.
And so with the prices of the 100 mil frankincense, I'll pour in, say, 2 or 3 mils into my little tub, shake it up, add some myrrh, sometimes some DMSO, which is a fantastic antioxidant, maybe a bit of peppermint. Those drive the essential oils into the cell and help kill things like squamous cell carcinoma, basal cell carcinoma. So I've had dogs where they like to sunbathe. We have vicious UV light problems here, both in Hawaii and in Queensland, the highest rate of melanoma and skin cancers here.
Wow.
So dogs that like to lie in the sun can be particularly at a problem. So I've made topicals that way. I've also used some Solacidine. So Queensland's really interesting because we had Bill Cham, and when Young Living essential oils kind of came across to this country, the farmers knew that the Hereford cows that we have here get skin cancers around the eyes. They have the white faces and they get, a squamous cell carcinoma. And some farmers noticed that the cows would rub their faces against the devil's apple and get the sap from the devil's apple onto their cancers, and the cancers would regress. And so Bill Cham was a biochemist who was living in that area and became friends with the man that helped introduce Young Living essential oils to Australia. And together they sort of worked through chemistry and things, found that suga and the Solacidine, which is in actually eggplant, the sap of eggplant, and in the devil's apple, and he made a cream called Curaderm. Back in the day when Joe Bijelke-Peterson was our premier, and they were friends. So he was a farmer, Joe Bijelke-Peterson, and he and his wife were into natural kind of medicines and things, being farmers. And so that got through, and you could buy this little tube of Curaderm for $30. So this is going back a few years. And it was 100% successful in curing early stage SCCs and BCCs. So you can Google that. Bill Cham is retired to his homeland in Vanuatu, where his family's from. So you can still buy it online. I think it's a lot more expensive. But anyway, there's another chemist down in New South Wales who has understood this. And so we buy some Solacidine, similar sort of cream from him. So I've been dabbling in these various things to help treat cancers. And for instance, spurge, the sap of spurge, which is a common petty spurge. You can Google the look of that plant. And the white sap that comes from that is also 100% successful in early stage BCC and SCC. So there's a lot to know about essential oils and saps of plants that can be super useful.
Wow.
That's
amazing. So, Dr. Cebuliak, so I have experience with essential oils. I was lucky enough one of my first experiences with my my local holistic vet was she was really into Young Living and essential oils. And I've done the whole, is it called the rainbow treatment, where you put a bunch of oils on their back?
Yeah, raindrop.
Raindrop.
Yeah, they call it raindrop. And so they have a saying, to be careful when mothering people, which is the mnemonic to remember the different oils that go in there. Oregano, thyme, basil, cypress, be careful, wintergreen when mothering, marjoram, and peppermint. So you use all of those and mix them up. I teach a massage workshop when I get around to it once or twice a year. And I give all of my students a bottle there. We put hemp oil or coconut oil in there. I made
as a base.
As a carrier base. And then depending on what they're making, so if they're making it for a small dog or even a cat, it's like 1 drop of each. and beware of like the dosing of that. If they're treating a large Great Dane, I say put 5 to 10 drops of each. Oregano as a hot oil can be a little bit burny, but you're putting it in a carrier base. But that mixture is amazing for trigger points. You know, trigger points when you get a matting. For instance, we were going to talk about dentistry later, but say for instance you have a dental pain here, you tend to chew on the other side, not that side, and so it's like if you put a woolen jumper in hot water, it sort of, you know, does that. So that's what happens to the fascia, the myofascial. You get a really tight area, and you can't really extend that area. You can't
Release it.
Release it, right? And so you can put a trigger point oil of that one, Young Living, or I actually modify it a little bit. I'll put different things in it now, a little bit of lavender usually. Marjoram is a really good one for muscle tightness. Yeah. So when I was working as a remedial massage therapist back in the day when I was young and pretty, and men would get a hard on, and I would put lots of marjoram because you get flaccidity that way. So it helps with muscle tightness. So you can
That's hysterical.
I know, right? You put a drop of that on your trigger point area, and then you massage it out, and so that will release it. So it's good to have that. And in any animal, but quadrupeds, dogs, if they've got dental pain here, the fascia, everything's connected. So that means that you're going to get some masseter muscle trigger point, you're going to get some neck trigger point, and because it's all connected, you're going to get some triceps trigger points on the foreleg. So you will actually see lameness that looks like lameness, which can be due to dental pain, which I think is often missed. And because the fascia, looking at the camera to see where I go with this, everything's connected. So the body is on a bias. The fascia is on a bias, right? Okay. So if you make the sheet on your bed really, really tight, and then someone comes and pulls the top right, then what happens to the bottom left? So think of that. Yeah. Think of a sheet and pull the top. So it's all on a bias. It's the same in the humans and same in the dogs. So if you've got, say, a left shoulder problem, then you will actually have a right hip problem.
Wow.
So the fascia will pull that, and you might end up with a medial patellar luxation from a dental problem. So, and that's just because the fascia is all connected. And I think these things are commonly missed, is not taught, because, you know, body work is not taught in vet school. Remedial massage is not taught in vet school. Essential oils is not taught in vet school.
Nutrition is not taught in vet school.
And dentistry, you'll be lucky to get 1 or 2 lectures, because all of the academia, I always say academia rhymes with macadamia. It's all nuts. You know?
Oh my gosh, that's awesome.
So that's what's happened over the years. It's like everybody's got their own little area of interest, and in their mind, it's the most important thing. So you've got the people that want to lecture in surgery. You know, you got to have lots of lectures in surgery. So up in the university, they're all kind of fighting for their time. You know, it's all about, you know, how much they get paid to. But, you know, that's fair. There's a lot to cover. Dentistry is a 5-year course. Vet's a 5-year course. So how in the world can people graduate with advanced training in dentistry? You can't. No. So, you know, you might know that you have to section the tooth and that they have roots and there's ways of tearing the periodontal ligament. But the poor new grads, it's a struggle. And as you probably are aware, the rate of suicide in the vet profession is extremely high. 1 vet every 3 months in this country kills
in
themselves.
Australia.
Yeah, but I think that's stats worldwide. So it's very unfortunate. I think there's not enough understanding of, you know, how difficult the actual profession is and how much ongoing study there is and how high we set the standards for ourselves, you know, because people that get into vet, they're at the top of their high school usually. Yeah. It's not easy to get into vet. And so you're used to achieving, you're used to being the best at what you do. And then all of a sudden you've got people telling you that you're shit. It's like, you know, that's just not fair. and then it's about, you know, the income levels, which are not as high as, you know, say human medicine stuff.
Yeah.
So there's a lot.
You know, so a couple of quick little notes. So let's cap off the essential oils. I want to just give you a little personal experience besides the raindrop therapy I did to my older dog when he was 15. I had my yellow lab, my cute yellow lab named Owen, very friendly, and he put his nose through a fence, and a dog bit him, and he had a hole right here, and so it was a pretty big hole, and so I talked to my holistic vet, and she said, "Well, just put some frankincense, Boswellia serrata, in a base of oil, and give him like 3 times a day, just a drop on that."
Yeah, it's
Do
great.
you know? And that not only healed, well, it was already healed over. It got rid of the scar tissue.
It does. Yeah, it's amazing. Actually, helichrysum's even a little bit better. They call it immortel. So adding helichrysum to your skin blends is amazing. Yeah.
Wow,
But
that's great.
helichrysum is very expensive
Mhm.
through most of the even more than frankincense. But helichrysum and frankincense together, and maybe a little bit of lavender, totally amazing. Yeah.
Well, that's
That's my
amazing.
healing herbs. Yeah, I really like my
Absolutely.
healing herbs. Yeah. Great
So
for it.
if we can just segue over into dentistry a little bit, I am thoroughly fascinated with animal dentistry. So, real super quick background because I'd love to get your thoughts. So, my experience again with this cute yellow lab Owen, he got a hold of a friend's dog's nylabone, one of those nylon horrible hard bones, which
Right.
I highly recommend against because it
They're plastic. They can
it
break.
busted his number 3 molars in the back, both of them.
It's
I
usually the carnassial, which is actually the premolar. They look like a molar, but you get a lateral slab fracture of the premolar 4, and in the triada notation, it's actually number 8 tooth,
Oh my
but
gosh.
usually not the molar. It's
Okay,
usually
okay,
the one in front of it, the carnassial tooth, the big one.
okay. Would that be number 3?
4.
Oh, that's
In the,
4. Okay, I'm wrong about that. Okay, so
yeah.
I noticed because I brushed their teeth, my dog's teeth.
Oh,
I
good.
noticed it was red inside.
Yeah.
And long story, I go to a pure vet dentist, and I end up doing 2 root canals on him. This
Oh,
is
you
like,
did?
I
Okay.
know, this is
In
like,
Colorado? Was that in
no,
Colorado?
in LA.
Oh, did you go to Brook Nemec? Or maybe we shouldn't mention names.
I don't remember I can't even remember his name. I would have to go look.
Okay.
But
Yeah.
anyway, so I went there. I got 2. So I actually did 1, and then it looked like he said, "Let's go bring him back. If this happens, it means we need to do another one." And then we ended up doing that on both. Fast forward, like this is like 15 years ago. Fast forward like 7, 8 years from from those 2 root canals. My holistic vet, who's amazing, in Colorado, he says, "You don't need to do that." He goes, "They're probably going to heal on themselves. It's probably," he goes, "That's what happens in the wild. They heal on their own." Is that your experience that
No,
those
I think that's incorrect. They don't.
Okay.
So I think the problem is, as I said, you get like 1 lecture or so in dentistry, and unless you've done a few more years and a lot of extra study and dental radiographs, so the dental X-rays or radiographs have only been available in the last 10-ish years. Like
Wow.
in the year 2000, I did my membership examination in oral surgery and dentistry. And in those days, we had to use a little box to develop the X-rays, like we had dark rooms. And so you had to put the film in the processing, and it was time consuming, and you'd have to take another picture if it didn't work, and you'd have 7 minutes developing each X-ray at least. So now we've all got digital X-rays and handheld X-ray systems. So you've got to get the angles right. And now in human dentistry, they've got some pretty amazing 3D
Digital.
kind of, but 3D even, you can really
Oh,
see what's going.
the cone ones.
Yeah. So the problem that I think not just holistic vets, but general vets that haven't done extra study is they miss a ton of dental disease, a ton of it. So what happens is if you have a fracture of a tooth that just goes through the enamel and exposes the dentinal tubules, you will get an ingress, a migration of bacteria from the oral cavity and the saliva in the tubules. And it doesn't even have to be into the pulp to still kill that tooth. And so I think with people and pets, a lot of dentistry is missed, and people put up with a lot, and dogs and cats for sure. Almost every day I see things that have been to other vets relatively recently, and then I point out, well, this tooth is fractured and this one has periodontal disease, and they're like, oh, but I just saw a vet the other day, and if you've got a 15-minute schedule for consults, and in that time, what can you cover, right?
Yeah.
So a lot of dental pain is missed, and then that stuff that we talked about with trigger points, all of that's missed.
Yeah.
And it shouldn't be, but there's a lot to cover, and
So do you think that the root canal that both root canals was a good call?
Root canals are tricky.
Yeah.
I pretty much don't do, so that's a 3-rooted tooth, and it's pretty hard to get rid of all of the bacteria in those teeth.
Yep.
I tend to extract the carnassials because they're a bit rough on their teeth. So after you do a root canal, they can still go and kill the crown work that you've done. Because I've had that happen, like a staffy that I did root canal on, and then I'm like, okay, so I can't do anything hard now because the tooth's going to be more fragile and they're potentially going to break it. Well, you can't explain that to a dog. So I've had them come in and they say, well, we're not feeding bones or anything hard, but here's the TV remote control. The dog chewed it up and he broke the crown. So then you have to look at redoing the root canal and then putting an artificial crown on, which can be made of porcelain or metal, usually a stainless steel blend. And so you have to get the dental technician to make that. You have to do an impression smear. It's got to fit right. You've got to make sure that the glue stuff that you use takes well. So it's quite complicated. So most of us nowadays tend to extract those carnassial teeth, and they do okay. The problem is if you don't have that carnassial tooth, then the lower molar that opposes it will not be self-cleaning because they're not generally going to chew on that because they're missing that tooth. So then you have to brush that tooth. But from a hygiene point of view, and the fact that you can have a focus of dental infection if you haven't been able to get rid of all the crap out of that carnassial tooth, because it's hard, it's a 3-rooted tooth. And also there's a horizontal part of the canal and then the vertical part. So cleaning and getting rid of all the bacteria when you're putting the filling in the root canal can be problematic. So a lot of people have problems with their root canals. They sit there and they smolder and there's bone infection and osteomyelitis. Removing the tooth gets rid of that problem, but then you don't have a great bite. That, as I said, there's nothing sort of to contact to make sure you chew on that side. But that's easily addressed just by brushing that area, but you have to brush it once a day, every day. And usually an electric toothbrush is a really good idea. So it's better not to break the teeth. And so that comes back to, what do we allow the dog to chew? Labradors are particularly problematic because they don't know when to stop. Because they
love it.
It's about the type of bone. And so I tell people, it's hard with the camera, the knuckle part of the bone, this end part, that's cancellous bone, that's soft. They don't break their teeth on that. But when you get down to the shaft and the weight-bearing part, that's where they break their teeth. Don't feed chop bones like that because it gets stuck on the carnassial, get stuck there, and then they just spike down and they get a lateral slab fracture. So those are the common places where they break their teeth, the carnassial on the upper maxillary jaw. Lateral slab fractures are quite common and commonly missed. I had a little dog in the other day, little Dachshund, and it came to see me for skin irritation and skin itch. And then I checked the teeth and both the carnassials, lateral slab fractures. And it's a 3-rooted tooth, so really the extraction techniques are quite important. So what I tell people when they're going to have dentistry, if you're going to a vet to have these procedures, just ask if they've got dental x-rays, because if they have, they've done some extra training and hopefully they won't break off a little bit of the root and leave it in. I've also had to go and dig out those bits of roots that are left in, and you'll get like a draining sinus because the root's got infection left there. And so it eats into the bone and you get an osteitis, so, a bone infection. So it's a bit tricky, So the other thing that's missed is often the canine teeth in cats. The pulp of the canine cavity of the cat's teeth go to within 1 millimeter of the tip of the crown. So they'll often just fracture a little bit off and you'll think it's okay. but it's like an open straw for the bacteria in the mouth to go straight up the highway into the bone, right? So you got to watch those cats' teeth, and very often that's missed. And you can tell after time the tooth dies and the color of the tooth becomes yellow.
Yeah.
So you compare, say, one tooth is broken and the other three are fine. The other three have a whiter appearance, and the broken tooth that's infected and dead will be more yellow. So that's a telltale sign.
Yeah.
And just with cats, you've just got to make sure that you're watching for the shape. And if that little tip is missing, yeah, that's a problem. It has to go.
It's a couple of things you're bringing up is it's really important, just as much as it is to, have your hands all over your dog, feel their fur and identify, let's say, a tick on your dog. It's also important to open up the mouth, get in there and brush, not only for brushing's sake, but to be able to see what's going on.
Yeah. And actually, you don't have to open very much. You just have to lift. And so with cats, I tell people don't put your finger in the cat's mouth because their mouths are filthy. And if they bite you, you can end up in hospital. Yeah. So you get a cotton tip and you use the cotton tip, or a soft, rubbery kind of a toothbrush, and put something really tasty on the end of it. So we've got like these little tuna pates or chicken pates or liver pate, and get them to do that. Even butter is a good idea, not margarine. Interesting story about margarine, remind me later. But if you put this in and get them to lick it, and also just kind of put some on their nose, like a bit of butter, and then just pat, acupuncture points, calm, massage the back of the neck. And then you can just do that and have a good look. So opening is not what you want to do, because if you open, it's tight and you can't actually do that. See, if you open, you can't see the back. So if you keep it closed and you do that, then you can see more. Yeah.
Yeah.
And so
coconut oil, right?
Yeah. So with a cat, you need animal fat more than coconut oil. Lots of people want to give coconut oil to cats. It's not that helpful. You can use it. The medium chain triglycerides of coconut oil are good for brain function in general for mammals, but butter is probably better rest of the time. Yeah. I was just going to mention about the margarine. So I had a hyperthyroid cat, and the owner of her own bat decided that she would use a cholesterol lowering margarine that they sell. But this is the interesting thing. It actually helped her thyroid. So from going from hyperthyroid, it was a cholesterol lowering margarine. And when you think about it, cholesterol is needed to make all your hormones, right? So when you look at the chemistry of hormones, they all have a cholesterol ring. Yeah. And then you add on, and it makes adrenaline, it makes cortisol, it makes thyroid, it makes estrogen, it makes progesterone, all with the cholesterol. That's why you need cholesterol. So with humans, when you see a doctor and they go, your cholesterol's too high, well, two problems with that. One is they haven't measured the HDL, the LDL, and the VDL. So you can't just make a statement about cholesterol in humans and say you've got too much cholesterol, because you really want HDL. It's a good cholesterol. But anyway, so this lady in her old cat, 20-year-old cat, can't argue with that. And she decided off her own bat, cholesterol is not good, so I'm going to give this cholesterol lowering margarine. And it actually helped her hyperthyroid cat, because it couldn't make the thyroxine that it was making before, because it was losing out on cholesterol. And I thought, well, that's an interesting segue of treatment. I never would have thought of that. She invented it. I said, we don't do that to cats. We don't feed them margarine. Margarine is bad. I'm like, oh, this was a treatment.
Interesting. Well, I guess if your cat's 20, they're probably pretty low on the other hormones. So it's probably better we treat that thyroid for the cat's remaining years, and you don't worry too much about the others. Is that right? Well, the reason we treat hyperthyroidism in cats is because it elevates the blood pressure and they blow out the retina and they become blind suddenly. So that's one good reason to treat hyperthyroid cats. And so we have, things that lower the thyroid level with chemicals. We also use bugleweed and motherwort and lemon balm, and the three herbs that we mix together, and that together with some drugs seem to be, you can use low amounts of drugs. But I thought that was super interesting that the margarine thing did that.
So that's another little treatment.
Really interesting. Where do you come out on the no anesthesia dentistry? Do you like that or no?
So all the qualified vet dentists, the specialists, really hate that. Now, and they also the dentists don't like to do this, but the general vet practitioners do. They grade dentistry as grade 1 to 4. That makes no sense to me, really, because if you've got a tooth that needs to be extracted, where do you put that? You put that in grade 4, like, I just think the grading system sucks and doesn't make a lot of sense to me. But with regards to those people that are claiming to do dentistry, so I went to a dental conference in America, and those are really great. The vet dental conferences now in America, there's thousands of people there. I've got the numbers.
Yeah.
And I was actually sharing a hotel room with one of these, she was a dog breeder and a groomer, but she actually had trained under, I think it was a prosthodontist or endodontist in the UK. So she was a dental assistant for many years. She knew the tools, she knew how to clean things, she could recognize periodontal disease. So she was actually doing this anesthesia-free thing to the pets. And so we were sitting in the lecture room together because we were sharing a hotel room, and the lecturer found out who she was and actually made her leave the conference. And I was insulted by that. I felt that wasn't fair. So I think broadly, there's a huge range of who is doing that. So this woman was well trained and was referring to vet dentists when she saw things that needed that. So the big issue is you can't see underneath the gum line, and a lot of these people are shutting down the dogs or the cat's behavior. So they're wrapping them, and they're not doing a fear-free thing. They're actually shutting the animal down.
Yeah.
And then it kind of hurts to use some of these instruments, and they can't clean underneath the gum line properly.
Yeah.
But having said that, I've seen multiple cases where there's just a bit of calculus, and it's super gingival, and the gum line's actually not red and inflamed. It's not a major problem, and you're just getting it a little bit back to square one. Chewing on a cancellous raw meaty bone or a rib bone or a frozen chicken carcass frame will usually clean that up. But there's generally about 4 areas that it doesn't clean up naturally, and that's on the lateral part here, the buccal part of the canine tooth, and then the lateral incisor. So those 2 on each side, so that's 4 teeth. And then
on the outside?
Yeah, just on the buccal, the lip side, yeah. So the inside, generally the tongue does a good job cleaning the inside. So often there's not a lot of calculus there, as opposed to humans. There's often more calculus inside with the tongues. But yeah, so I think it's a good idea for people to look. And I do have clients that use the back of a spoon, like a calculus, super gingival thing. They just use a spoon, go like that, and that'll get the calculus off. So I think some of those anesthesia-free guys are okay, but some are not. And people are paying sometimes quite a lot of money, maybe $500, and thinking that they're getting a good job done. And then we'll see the animal in later, weeks or months later, and there's loose teeth and there's periodontal problems, and they really needed, they were just wasting their time and money, and the animal was not being treated accordingly to the outside could look a lot better. They've got some calculus off of the super gingival, below the gum line stuff. The stuff underneath the gum line is not being addressed with those people in general. Yeah.
So when you said they're shutting the animal down by wrapping them or whatever,
Right.
what does that mean?
It's a behavior.
Is that bad for? That seems to me like I would not want my dog to be suppressed or have to go through that in a conscious state. And I'll tell you in a second what I do with my dog, which is different than anesthesia. But do you think that's for most dogs? It's not healthy mentally, or is it even like
that can be the case? But I think it does vary a bit. So there are some not qualified vets that are doing that, but have had a lot of experience with animal handling.
Mhm.
And, you know, like, for instance, Caesar Milan, a lot of people don't like him. A lot of people still like him. I was able to acupuncture a dog for his show when he was coming around Australia, and we had a good chat. He's got black belts in martial arts, so his body is still and calm, and he is able to calm most dogs with this body, mind, spirit stuff.
Mm.
So some of those anesthesia-free dentist type people, depending on their qualifications and how they approach the animal, some of those animals are probably not shutting down and are probably relaxed and allowing them to do their job. Some might have some experience with animal massage and might be able to produce those endorphins. And so it's hard for me to make that blanket statement across, but I will say that the specialist vet dentists see far more harm than good in the cases that come. And mostly that's to do with the fact that the owner's been going to a anesthesia-free dentist,
Yeah.
quote unquote, every 6 months or a year, spending lots of money and thinking they're doing a good job. And in fact, underneath the gum line is really horrible, and they're not really having the job done.
Yeah. So are you also suggesting not only they be given some anesthesia so that you can really look and clean deep under the gums, but also be able to take pictures, right? Because
Right. You can't put an
anesthesia,
X-ray film in the mouth without the animal
yeah,
biting down and wrecking your really expensive stuff.
yeah, yeah.
And you can't
So
get a good picture because they're moving. So, yeah.
what I've done for the last 10 years is my dogs get twilight sleep
Mm-hmm.
and they get a full dentistry, deep cleaning
Yeah.
from our vet. But you can reverse that really
Yeah.
quickly.
Yeah.
And
There's some good sedatives. Yeah.
yeah, so what do you think of that?
I think if you're doing what you're doing, which sounds like you are, and you're brushing, you've got good oral hygiene. And so you probably don't need to knock them completely out.
Okay.
But a lot of the cases that we see don't have good oral hygiene and really need to be knocked out completely. So,
Right, because it's painful to get in there and clean it and do it right.
yeah.
Yeah. Okay, that's great. That's good.
Yeah.
Really good advice. So tell me, you do quite a bit of work, or you've done like Vets Without Borders, and
Yeah.
you've been in Bali, Cook Islands, Northern India.
Yeah.
I'm curious how these dogs in, like, let's say Bali, which I'm very jealous. I know it's a hop, skip, and a jump for you.
Oh,
I
you
mean,
should come. November 3rd to 6th. You should duck down.
what do you mean?
Definitely. Well, the Chi Institute has their annual vet conference on, which is on the 7th. So I'm speaking, giving a lecture there. And before COVID, I'd usually go over to this little island, Nusa Penida, where I've made a bunch of friends and have been like their white ibu. I used to go, I think I was one of the first tourists, which was super fun. I'd be walking along the beach and you'd hear, Siapa Anda? Who is this? Who is this? Siapa? and it was through a friend of mine who's a vet in Bali, and he actually did this amazing work saving a species from extinction. The Bali starling is a little white bird that has this blue eye, and it's their emblem bird of Bali. And there was only 7 or so birds in the wild left because the aviculture, people that like to keep birds would go and get them kind of illegally, as the bird trade is,
Wow.
And when he was going through vet school, and as a kid, he always loved birds. So he decided he would devote his life to saving wildlife. And then he thought he would figure out a captive breeding program to get the numbers up again. And he actually got breeding pairs from the UK and from the United States from these really rich people that had birds. And
Wow.
he came to Australia and met some friends of mine who are bird specialists. So it was Ross Perry and Patricia, who wrote the book Every Bird. And so he came out here. His name's Bayu Wirayuda, and he's actually one of the royalty lines in Bali. I think there's 4 king kind of lines, so he's like a prince. So he came out after he studied vet and figured out how to do a captive breeding program for the Bali starling, and then set it up in Bali. But he figured out, so the birds were selling for about $10,000,
Okay.
which is really sets a Balinese family up for life, and
Sure.
you can see why they did what they did illegally. But so he figured that if he did the captive breeding program in Bali, they would just get pilfered, and so that wouldn't work. So he and another vet friend of his called Bom Bom went to this little island of Nusa Penida, which is known as a sacred island, and people go there to all over Indonesia to pray at the Ped temple once in their life.
Wow.
And so he and Bom Bom went around to the whole island and went to the little communities, there's about 30 of them, and got them all to sign a wig, which was an agreement that they would look after the wildlife and not steal them and not sell them. And so they spent 3 years doing that, and then they set up this captive breeding program in Nusa Penida, and I actually wrote a children's book about this story. And then they were able to raise these birds there, and now there's hundreds, from the birds that he brought back. And so that's my connection to this little island. It's quite a spiritual island. It's quite cool. And so during that time, when I went, I made a little eco tour group with my friend Ross Perry, who's since passed away, unfortunately, and a few other vet friends that came across. And when I went on this eco tour, we had a young student that actually had just finished high school and was working for Dr. Bayu in his breeding program. And so his job to look after the tourists was to look after me and a friend, and he made us breakfast, and I was on the back of his motorcycle, and anything I needed, he went and got it. It was really nice. And so I was just there for a few days, like 4 days, and I really liked the island because of the snorkeling, and I grew up in Hawaii, and so I was used to, going snorkeling and beach and stuff, and it's perfect. You just walk off the beach and you can do the drop off, and the corals all there. And they have seaweed farms around there. Actually, a recent movie with Julia Roberts talks about this. They filmed it in Australia during COVID, but it's about Nusa Penida, that movie. I was so shocked when I watched it. I'm like, oh my God. So anyway, so this kid, Cadet Wadada, became a good friend of mine. I asked him before I left, what did he want to do with his life? And he said he wanted to be a vet, like Bayou, but no way he could afford it. So his parents and most of the people on that island made money doing seaweed farms, and their income was about $2,000 a year. That's it. And I was like, well, how do you afford to make a house? And he said, oh, that's easy. We just call our friends over on Sunday. Can you help us build a house? And they do. And I said, well, how do you pay them back? Oh, that's easy. When they want to build a house, we go to their place and we build a house. I was like, oh, okay, that's cool. But it was $1,000 a year to study at Udayana to become a vet. And when I found out it was $1,000, I went, that's okay, we can do that. So I made a scholarship for him. And Pat McWhirter, who wrote Every Bird, also helped. So we put him through, and he was like president of his school, and he did really well at Udayana. So he's been out for several years. He ended up falling in love with a student that was 1 year behind him. Her name is Bulan. So they're both vets, and they got married about 3 years ago, and I was able to go to their wedding. It was amazing. I should send you some photos.
Please.
And so he's like the only vet on the island. And because he did so well and was well liked, they gave a free scholarship to his brother. So they're both vets now on the island.
Wow. Yeah,
so
send me those pictures. We'll put them in here.
Yeah.
So do you see any? I'm always curious, for these other countries where dogs are roaming around, scavenging and all that. Do you notice any differences in the health of dogs compared to, say, like Australia or United States, or
Yeah. So in India and Bali, interesting story in Bali. So they're more Hindu in Bali, similar in India actually, and they put out little offerings in little kind of baskets, little square baskets, and they put an incense stick. So it's usually rice, and they do this 3 times a day. So you'll see them outside. So the dogs sort of get around to eat that. But I usually find the dog attaches itself to me wherever I go, and and it's like your buddy. Oh, this is my dog. Okay, fine. And I'd be walking along the beach, and everyone would go, is that your dog? I'm like, for now it is. Anyway, I was having, toast and butter, and I put a bit of toast out for one of these dogs that was hanging out with me, and it looked at me and went, it wanted the butter. It wanted the fat. And that's what you see on the coats. They're just dry and harsh, and they really need the fat.
Wow.
So they get free carbohydrates from eating the offerings, which is saffrony kind of rice. It's got turmeric in it, which I guess
Yeah.
is good. But yeah, they really needed the fat. And when we were in India, just trying to get those dogs healthy, so cows are
Sacred.
respected, so they don't want to feed the cow, but they
Yeah.
will feed goat. So we got them to give them goat bones and things from the local butcher, to get the
Yeah.
fat and the
Yeah.
things. So they're not all that healthy, but some of them are. Some, people feed out of the restaurant scraps. Yeah.
Wow. Well, tell me, let's spend our remaining time, which is about 15 minutes. Let's talk about your interests and work in cancer. So I know it's mostly the two big buckets we have that you're interested in are dentistry and cancer, right? Kind of, if we can
Well,
simplify it.
it's what's happened to my working
Yeah.
life. Yeah.
Where you've gone. So yeah, let's get into cancer. How do you how do we start in that topic, that big topic?
Yeah. Well, I think going back to what we need to do to clean up the planet and try and stop these horrible agriculture chemicals coming in, I think glyphosate is a big, big thing.
Yeah.
Stephanie Seneff, if you want to look at some of her work at MIT,
Okay.
Seneff, she's done probably the most work in this area. And then Kennedy has got some really interesting data and information. There are all kinds of lawsuits at the moment. There was a gardener of a school that was wearing a backpack of weed killer, glyphosate, Roundup, and he ended up getting all these cancers. There's a big link to lymphoma and
Yeah.
leukemia. I had a human patient in yesterday, a 1-year-old child that's being treated for leukemia. So there is there's definitely a link. It comes through in the breast milk as well.
Yeah.
And the problem with the wheat industry is they ripen the grain with crop dust.
They use it as a desiccant.
Correct.
Yeah.
To ripen the grain. So when they get like a 70% yield, the grain has to turn yellow. When they spray it, they get a 90% yield, so they get more money. So
Yeah.
their thinking was it's safe because humans don't have a shikimate metabolic pathway. But what they haven't figured out is that the mammals, humans and all mammals, are 90% bacteria, gut, and 10% human or 10% mammals. So we rely on our gut to make serotonin and endorphins, vitamin B, vitamin K. And initially, glyphosate was registered as an antibiotic. And so what we're doing when we're eating that with our wheat and our flours and our breads is we're wiping out our good bugs. And not only that, it's got a growth promotant for the gram negatives. So all the things that cause inflammatory bowel and gut problems are being helped when you're eating the wheat and the grain. That's why there's so many non-celiac gluten sensitive people. Is it the gluten or is it the glyphosate? So this is a big thing, and it's a big thing with the pet food industry. When you read the bag of food, no matter what brand it is, if it's wheat. So, and it can be split up in the label. It can be wheat and gluten. They use the gluten to hold the grains and the product together. It's a sticky protein, and they also count it as the percentage of protein when you're doing the AFCO analysis because it's protein. So that's a really, really big problem. We need to get those chemicals out. So in I think most places in Europe it's outlawed. So you can just get flour from Italy, and the soils in Italy are also better than the soils in Australia. Our soils are deficient here in selenium, boron, manganese. So just having some of the, if you're gonna do flour, maybe use Italian and get the pasta. if you got to do carbs, basically in dogs, for instance, as you know, there is a zero requirement for carbs. I haven't been following your program. Have you had Karen Becker and Rodney Habib?
Not yet.
Oh, you have to. They're wonderful. Yeah.
Oh, they are wonderful.
Yeah. So I mean, their book, The Forever Dog, is so mind blowing for most people. So part of my consults, I'm like, just go and get The Forever Dog. It's on Audible.
It's amazing.
Yeah. They cover all of that area quite well. Yeah.
Well, that's really great advice, and I buy pasta from Italy, the bronze. What is it called? Bronze stamped. What is that called? Bronze.
Yeah, there's a few.
Yeah, something like that, where it's minimal
Yeah,
processing.
yeah,
Yeah,
yeah.
it's really good over there. Yeah, the glyphosate is we have no clue.
Mm,
We could talk about it for 4 hours. We have no clue
yeah,
just how bad it is. We know it's
yeah,
horrible.
yeah.
It's
Everyone's falling apart. It's so sad. And Hashimoto's thyroiditis is super common and commonly missed. I think the thyroid problems in both pets and people are just unfortunately missed. So in dogs, I'm always like, if
yeah,
they've got a rat's tail, they've got edema, they've got the weight gain, and their coat doesn't look so great, check the T4. But
yeah,
that's only a very small part of looking at the total thyroid picture. You really need to look at thyroid autoantibodies, and nobody's checking those in dogs in general. And in humans, they just look at the TSH, and it's based on a sick population.
yeah,
So your thyroid stimulating hormone levels that they see as normal is 0.225. And in fact, some of the labs have cut that back to 4. But really, anything over 2 is a problem. When you have to put a TSH up over 2, you've got a problem. But to get the doctors to check, I mean, someone's got to pay for all these blood tests. In Australia, we have a really good healthcare system. A lot of our stuff is free. And so I'm pretty happy.
for people.
Yeah, for
Yeah,
people. Yeah.
yeah,
But so you have to ask your doctor all these correct questions to get the testing done. I've got unexpected weight gain. I've gained 1 kilo every week for the last few weeks, and my hair's falling out, and the lateral third of my eyebrows missing. I just tell them, state all these things, and maybe they'll test you properly. Otherwise, you have to pay for the extra bit, because the government will pay for TSH, but they won't
okay.
necessarily pay for autoantibodies. Now, the same with dogs. You've got to send stuff off to Gene Dodds, and the local labs don't do that. Most vets have,
Hemopet.
most vets have their own in-house thing. So I just look at the T4 in the dog and go, all right, if it's low normal and they've got 2 or 3 signs, we just treat. Because this is a problem nowadays when people are short on money, income. Lots of people have lost their jobs with COVID crap, and it's hard. Yeah.
Yeah.
So, if
Can
you
you
yeah.
can you with my older dogs, I've we do the regular testing, blood testing, and then when you see an indication of something, you can go deeper and spend the money on a thyroid. You don't have to right at the beginning, but if you see any indication, you can go into the hemopet.org website, and they have like I remember I did the gold thyroid panel.
Yeah.
But explain just briefly that Dr. Jean Dodds has her stats are not based on sick dogs, right?
Yeah, she's looked at breeds. And she's, because greyhounds have a lower level, and different breeds have different levels.
Yeah.
And a lot of pathologists don't agree with her, but I do. And she knows her stuff. She's a smart lady.
Yeah, I've had several holistic vets that say that's the only way to go is those deeper. And if you go to their website, which is shout out to hemopet.org, if you go look at their thyroid test, it's ridiculously comprehensive. As a layman, you'll never be able to sort through it. Have your vet, if your vet doesn't know what they're looking at, you might want to look for another vet. That's my opinion. And
or try and educate them and get them to have a look.
Yeah. I mean,
I'm
all for that, but if you can't do that, you might have to move. Did you say the shikimate pathway is not present in dogs?
Yeah, it's not a mammalian metabolic pathway. It's used by plants. That's why it kills the plants. Yeah. And it's used by the bacteria. And so their thinking was, it's got to be safe for humans because we don't have a shikimate pathway. It's toad medicine. In Australia, they introduced cane toads to try and help get rid of the insects in the cane fields, and then it kills all the dogs because of the bufotoxins in the back of their head. Oof. So we call it cane toad medicine. This is a good idea. Let's just do this.
You start messing with nature.
Yeah, exactly. Yeah.
Wow. That's incredible.
So going back to fixing the planet and fixing people. So I think the microplastics are the biggest thing that we can address right now, which is this is a horrible mess, because, you know, especially in the Asian countries when they don't have good recycling, we're trying to get that going. So this is my latest project, which is why I said you should come November 3rd to 6th in Bali to Nusa Penida. Just come. So I've got another student that I helped through uni, and he's a teacher. He was really interested in physics. So I'm friends with the local English teacher at the high school there in Nusa Penida. And I asked him to give me another student I'd put my vet student through.
Yeah.
And he recommended this student who was the top of his class, and his dad's a priest on this island in Nusa Penida. And so I helped him through uni. And so together we have all these little projects, which has been a huge interest in my life and made my life super interesting. So he's interested in ecology and also recycling plastic. So this latest project, I wrote a little story about a pretend kid that's picking up the plastics from the beach and recycling it and making them into eco bricks. Eco bricks in 1990 were developed by a Canadian. They're the plastic drinking bottles that everybody buys because you can't drink the tap water. And then they discard them. And then the plastic soft packaging in all the snack foods, they end up littering the beaches and going into the ocean, and all the plastic bags just, you know, they're eaten by turtles and they kill the wildlife. So in the last few years, we've had a few projects. One is we made a library on the island, brought over 300 kilos of books with some friends of mine, and they love the Dr. Seuss books, and they use them to learn to speak English and things. And then they had no books in their own language. And so they have a local Penida language and then the Bahasa Indonesian. And they don't know a lot of English and that. So I had the kids write a story. They had to be an ecology story. They have this big sunfish called the mola mola that they're quite famous for. So a lot of kids chose to write a story about the mola mola eating a plastic bag and dying. And we had them draw the pictures, and I produced the books for them, and we put them in the library. And they had the 3 languages in them. They had English, Nusa Penidan, and Bahasa Indonesian. So we did that. And so this last project is about getting the kids to make a bunch of eco bricks and making a garden out of them. So I'm going over to give some scholarships to the kids that made the best garden and the most recycling. And so that's this last project. And then we're trying to get the Finnish government has made this thing called eco blocks. So this is fascinating. In Lombok, one of the islands near Nusa Penida in Indonesia, they had Gempa, earthquake, and a lot of the schools in 2018 were demolished and lots of buildings fell down the hill. But this amazing technology in Finland was developed, and they take the plastics, they melt them down with wood, and they make these things called eco blocks. And they're like Legos, like this big. Camera. See the camera. Okay, so basically they made these eco blocks in Finland, and they shipped them out, and they built the school in 3 days. So you lay the concrete down, and then you've just got all these Legos, and you just Lego them in. And the technology is these blocks will last for over 100 years. They look good, and because they're like Legos, you just block them into each other, and you build a building, and it's super easy to do. Wow. So in this little book that I wrote, I'll flick it to you. You'll send me your email. Oh, I've got your email. I'll send it to you. Cool. And so we're trying. So in this book that I wrote, this pretend kid is asking the Finnish to come and build a factory to make eco blocks. So I think if we can get a lot of eco bricks and a lot of eco blocks, then the plastics become a commodity. So we're trying to get them to save the plastics in a containers near the beach so that you can access them, because they don't have that system, you know. So I've got people making big nets so that the tourists and the locals can throw their plastics into it, so it's all collected, and then they can recycle them into eco bricks or eco blocks. If they're seen as a commodity, they won't just throw them, so that they end up in the ocean. And then that'll help.
That's an incredible solution to create a commodity. What do you think about all of this, like athleisure wear that's like nylon and polyesters? Every time it gets washed, those are microplastics that are going in the water supply. Like, what do we do about that?
Yeah, it's a good question. Yeah. I'm hoping that the bacteria and the things that break down, plastics will start to take over, and there's got to be a solution in nature.
Yeah, I certainly hope so.
Mushrooms will do it.
Mushrooms. Yeah.
They do break them down. Yeah.
Well, on that note, we're at an hour, and Dr. Cebuliak, this has been amazing. This has been really stimulating conversation, and I appreciate all that you're doing over there, and I appreciate your offer to go to Bali. I just need a little bit more than a month's notice to go, but I absolutely want to go.
Oh, you've got the internet.
Oh, I can go virtually
wherever you are. You just come.
Well, I would love to do
you
that.
Just hop on a plane and you go.
Yeah, I would love to jump on a plane and have unlimited watermelon juice.
That's your favorite? Yeah.
Oh my gosh! And be in beautiful Bali. Are you kidding me?
Oh, the jamu. Have you had the jamu? So
no.
Jamu is turmeric and pineapple and some lime usually. So good for you. Yeah.
Heaven.
Yeah.
Heaven. Oh my gosh. Yeah, it's completely totally on my list. I think next year this 2024 I'll be in Australia. So
actually, do you know the Pet Summit guys? They live there. Yeah. So he lives in Bali now. You go hang out with him.
Oh, that's right. Yeah, Scott.
Yeah, he's in Bali. Yeah. I did a Pet Summit thing a few months ago. Yeah.
Yeah. No, yeah, that's right. That's right.
So I asked him, so do you speak Bahasa? He had to look up what Bahasa was.
Wow.
It was funny. Yeah.
That's great.
So that's why the date is when we're giving out the scholarships. So that's November 4th. We're going around to the schools and giving out the kids scholarships. So that's why you should go.
Oh, that's wonderful.
Yeah,
that's
great. It's good for international people to see that. And then I think that's the biggest, most important thing we can do with our life. Like we can help dogs eat better. We can help them live longer, but we've got to save the planet. We've got to save the wildlife. We've got to save the fish, because that saves ourselves and the dogs.
Yeah.
So it's important. Yeah.
Amen to that. Well, on that note, thank you, Dr. Cebuliak. This has been so nice, and I hope to continue conversations with you. We'll now be pen pals.
Okay, I'll send you the story, the EcoBrick story.
Great.
Okay.
And send me those pictures. I'll put them in the show.
Okay, will do.
All right.
Okay.
Have a great rest of your day, and thanks so much.
You're welcome. Okay. Bye.
Bye.